One, what inspired you to pursue graduate study in your chosen field?
Honestly, my motivation goes way back to my childhood, especially my return to Togo, in the year 2020. I was serious. I was in a serious injury. I had a serious injury. My bad. I had a serious injury. And my fingers was cut. Um, and right here, my fingers was cut, and there was a my bone was showing, so I had to go get a stitch. Um, when I went to the hospital, the neighborhood hospital, the condition that which I saw were were astonishing. It was shockingly poor. Um, it really hit me how much the environment in which people live can shape their health and their life, and even with their chances of surviving with something simple, like a cut that need to be stitched, can affect their life. Um, so when I came back home, I decided to start studying public health at Georgia State, and doing so, I started learning about things like environmental exposure, disparities, preventable illness. And while doing so, everything clicked. I realized that this was the pathway which I could turn what that I experienced in Togo into something meaningful for pursuing an MPH. So I decided to, you know, go to the next level and pursue an MPH in environmental epidemiology. I feel like this will be the next step towards helping to improve conditions that impact communities like mine in Togo, for example, or a lot of other undeserved community here in the United States.
Two, how have your undergraduate experiences prepared you for graduate school?
Um, my undergraduate experience at Georgia State has given me a strong foundation. Courses like epidemiology, statistic, informatic, environmental, health, program planning, helped me build skills in data interpretation, research method evaluation, understanding how system influence population and health. I've also completed projects where I created logic model, and conduct needed assessment. I've analyzed data, even learn how to read and describe policy brief. These experiences help me practice competencies like data analysis, critical thinking, communication, teamwork, ethical use of information, and all that prepared me to handle, I believe, expected graduate level coursework and as well as field experiences.
Three, what are your main academic or professional interests within this field?
I am most interested in environmental exposure, to helping disparities and exposure health disparities, community health prevention. I want to understand everyday environment like water quality, air pollution, waste system, or housing shape disease risk, especially in low resource community. A lot of my academic work already connect to this, like analyzing chronic disease trend, studying environmental health topics, and working with real data set. I'm also interested in global health and how environmental epidemiology can be applied in places like Togo where infrastructure is limited. These interests, I believe, tie strongly to competencies that I've developed in data analysis, community assessment, and system thinking.
Four, describe a challenge or obstacle you faced during your academic journey. And four,
Um, One challenge I faced was balancing. I tell people this. People ask me this all the time. How are you able to do it? How are you able to do it? And the challenge is, how are you able to, face, going to school full time and while working full time. Um, of course, the workload can be intense. Working all day. Um, processing specimen all day and then switching into academic mode at night. What helped me was learning to stay organized, and honest with myself about my limits. I create a routine. I use planners. I stay ahead of assignment. And sometimes, instead of waiting until the last minute, again, sometimes it taught me discipline, time management, and resilience. Looking back, the experience actually prepared me for a lot of things, and I think it would be helpful for me in graduate school.
5. What skills or personal qualities make you a strong candidate for this program?
I think a few things stands out. I have a strong analytical skills from working with data in class, in my public health projects. Um, I'm used to working in high pressure environments. For example, working in my lab, I bring a lot of global perspective because of my roots in Togo and my ancestry being from West Africa. I'm also very committed. Public health isn't just an academic interest for me. It is personal. I'm motivated by real life experiences that shape how I see health inequities, and I've built competencies in coursework, communication, research method, and professionalism, and ethical decision making through both school and work, and the people that I'm around.
6. How you manage your time and balance multiple responsibilities? 7.
Um, well, like I've mentioned before, I work as a full time at a Agrady hospital, and I'm also a full time student. So being able to balance both, it's a pretty it's pretty difficult at times. But like I said, I've managed to find a system that works for me. I build routine and I stay around the routines. I've set schedules. I plan out my weeks. I make sure I put down everything that I need to do in my planners. I try to get some work done earlier in the week so I don't have to wait until last minute to push them. I try to pull everything together as much as possible. I stay disciplined and I try my best to stay on the schedule that I set so that it don't backfire on me.
7. What are your short term and long term career goals after earning your graduate degree?
Short term, I want to work as an environmental epidemiologist or research analyst focusing on environmental hazards and public health disparity. Ideally, in a setting like health department, CDC, environmental health organization. Long term, I want to do international work in places like my country, Togo, improving environmental health systems, strengthening disease surveillance, and helping build safer living conditions. My career goals connect directly to my competencies in data analysis, system thinking, um, equities, and program evaluation.
8. Tell me about a project, paper, or experience that you are particularly proud of and what you learned from it. 9. How you handle.
Um, One project that I'm proud of was in my one of my class assignment by statistic assignment in where I am to use enhanced data to analyze association between risk factors and chronic diseases. It wasn't easy at first, but I pushed it through. I learned how to interpret all ratio, organize data set, and present clear finding. I believe that project made me confident in my ability to handle some real world data and apply epidemiologic method. It also taught me how to this taught me the importance of communication and as well as result interpretation so people can actually use them in real life.
How you handle feedback or constructive criticism.
Um, I know some people don't really like to be criticized, whether constructive or not. I know a lot of people don't like to be criticized, but me personally, I actually appreciate feedback, especially constructive criticism, because they help me grow. In the lab, feedback is constant and necessary. You could make an error that affects patient care, so you learn to listen closely and adjust quickly. In school, professors have pushed my writing and data interpretation skills, and I've learned to see criticism not as something negative, but as something to guide me, and to strengthen my work. I try to understand the why behind the feedback, and I try to use it to interpret my and to improve next time and do better.
10. Why do you believe you would be a good fit for a graduate program and the field overall?
Well, I think I'm a good fit because I bring together academic preparation, hands-on health experience, and personal commitment to environmental and global health, environmental epidemiology, and global health. My bad. Environmental epidemiology isn't just an interest. It connects to my life. It connects to my life experiences with my family and my community I care about. I want to be part of a solution that protects people, especially those who don't have the resources to protect themselves. Um, GSU focuses on equity and applied research align perfectly with my goal, and I'm ready to contribute my perspective to the field, and I'm going to share my work ethic and my discipline and my resilience to the field, and hopefully that my passion can come into reality through the Georgia State program. My name is Roger Ayete. Thank you very much for having me, and have a wonderful day.